Today we're going to talk about a subject in QSM3 about pathways, where they are, and maybe a little bit of a pattern approach to correcting it. Danielle's on the table. We just checked her on the anatometer. She had right weight, she had a right bow, right head tilt, and everything is right leg, right weight, right pelvis, right low pelvis, right shoulder, and everything is anterior and the head sits off right. So biomechanically unsound. So we're going to start her left side up. She is what's called an LP same, which is left side posterior pathways first, because we're opposite the weight. I've got her left side up. The first headpiece position is up. And there are the pathways on this side for posterior is the C1 anterior and posterior pathway right at the mastoid, which runs down to the SCM. You've got just back right here, which is a internal spinal pathway, which is the trap. And then you have an internal, you'll come down, this is all internal, it's like a ski slope here. And then the clavicle, I only work the clavicle on the side of the head tilt, because that's where that SCM attaches and a couple other the muscles that will actually pull down and pull the head down on the shoulder. It'll draw the shoulder up and create compression on that side, and that's why the head tilt is there. So we're going to start right here, and I'm just going to come in posterior, and you want to come in nice and easy. This is a superficial pathway, so you have to start light. Right up under the ear, you'll feel the attachment. Okay, so now I'm going to come in, I like to come in backhand here at the posterior pathway here. So you see I set up against the path, P to A, and then pop through it. These are deep pathways, that's why I'm holding and putting my mass against it, because I already cleared the superficial and the intermediate before. So here it is. Okay, that's clear. So now I'm going to go back here and I'm going to work my way backwards. I like starting at the C1 area. Come a little closer. You'll hear it move. Working the sweep, P to A. Clearing the floor. Now I'm coming all the way back to the posterior, the external spinal. Very small there. Running my hand along the occiput. So that's where the attachments are. That's where you hit those Golgi tendon apparatuses. Or fibers. Here's more here, right here, you can hear it. See how this is responding to speed here. Some are slow, some are fast. Okay, so now we're going to stop here. We're going to drop the headpiece down, go to decompression, and do the same thing. Check superficial. Very small little pieces. Now I'm going to go intermediate. You'll see me pull it, I'll grab it, and release it. Hooking it with the piezoform. Okay, and then it's done there, but there's still stuff there, so it's going to respond to deep. That's where I like to turn, because I like to get my mass up on it here, because I'm right on top of it, and then I use the back of my hand for my P to A leverage. Using anterior torque right here. This fiber right here at the SCM, which I call the mastoid pathway, likes superior torque to break it. And it's all completely clear. I'm going to go back right here, posterior to the internal, loaded up right here. This is releasing the head off the shoulder, and it's also releasing the spinal pathway all the way down here, down into the pelvis. Got to clear this, otherwise the person will not stand sagittally correct. because there'll be tension in the posterior pathway and it'll just pull the person into extension. And that's clear. Check here. You could hear that. It's going right down from the occiput C1, C2 all the way down, straight down. Okay, so once I've cleared everything, I like to sweep. Here's some, and see I sit on it. When this is deep, all the way deep pathway. Probably one of the skull muscles, the suboccipitals. And watch how I clear last by sitting on it and releasing it, squashing it out. There you go, and she's clear. Okay, so now I'm going to check her because she's a right. I don't go to third position on this one ever because this one could clear it out. Come on up for me. Anterior twist of 9. She now has an anterior twist of 3. The body is, and I'm just going to recheck this, because the body is still sitting out there, way out there on the right side. So what I'm going to do is I'm going to flip her over anyway. She's still sitting at 20 pounds, so I have not released the frontal plane pathway, which is right to left. All I've released is the decompression and the integration. Now by having her on the right side, we're going to find that linear pathway on the right, or that circular pathway that just may be holding the upper part of the body and just bring that kind of up. All right, so we'll check this one, the circular pathway, down position first because she's the same, and then we're going to go to an up position and just check the linear pathway on the right. We'll check them both at the same time. All right, so she was right anterior, so we're going to lift the chin. That'll traction the anterior pathways. We'll push the pelvis back, push the shoulder back. I'm using a down head piece right here. And I'm going to come in anterior. This is the one, because she has a right head tilt, that's going to release that right head tilt off the shoulder. Starting up at C1, anterior, and nice, easy. This is what we call superficial, just touching the tip of the toothpick, and you could hear it move. Okay, now I'm going to go intermediate, slower pull, a little deeper. It's like hooking with a hooking needle. Grabbing that tension line, pushing through it. I grab it here, pull it like I'm stretching a rubber band, and then with my wrist lever right at the end, release. Push through it. Right here, tension, release. Tension, push through it. Push through it, and there it is, gone. Now I'm going to go deep. Now I like standing above it on deep because I can get my whole body mass against it. And I like backhanding on it. Now watch on the deep how I hold it, I get into it, and then my whole body mass. And my leverage is downward into it and across it, not just across it like the intermediate. Okay, that's clear. This is a crucial point right at the angle pathway to allow the shoulder and the head to release. Okay, so we're going to check here. And then I'm going to start following it down. A lot of tension right through here, this right here through the myofascial net, myofascial envelope, coming down. And I'm actually going to come into the anterior pathway, which is the clavicle holding it. That'll hold that chin down and pull that whole head into an anterior translation. Released. Now I'm deep. And it's clear. So now I'm going to check right here. Anterior and posterior. Okay, those are clear. Right here, I'm just going to come down the SEM right here, and it moves. This area right here will always be loaded up on the side of head tilt. Here it is, right against the clavicle. Clear, clear, clear. Now I'm going to come up in the frontal plane. I'm just going to check that because I've been working with Danielle for a while. She's a TN patient, and we're going to make sure that we just check the frontal plane on the right side. Frontal plane, I just come along the skull, hitting the points. There's 8 points on either side. Here's some right here. It's that internal spinal. Clear, and I'm going to come down the ski slope, right here into the trap, into the clavicle, making sure it's clear. I always like ending at my anterior C1 because it was anterior on this side. I would have, if it was posterior on this side, I would have checked posterior. And I always check this spot right here. Okay, so we're getting her checked here. Just checked her. She's sitting at 4.8 pounds, so she's gone from 20-something to 4.8. On to the right, that's not good enough. Her twist is down to a -1 in her pelvis. Her shoulders are -2. I'm just going to step in front instead of putting her on the grid. The head is completely balanced. Okay, and what we're going to do is I'm going to check the weight one more time because as Dr. Hirschhorn said yesterday on a webinar, he says when you hit the ball, you got to wait for it to run over, to get over the fence sometimes. And we just got her check. Come on over here. You can see the data. We have 83 pounds on the left and 79. So she's gone from 20-something pounds on the right to a few pounds on the left, and that's what we call a grand slam in QSM3. So she's decompressed and totally taken care of. She is a same misalignment. She's 100%. Everything's been taken care of. The integration, the decompression of the whole body, the rotation of the shoulder and the pelvis, and the head is sitting up on center and the body is vertical. What else can you ask for? Thank you for joining me today. I'm Dr. Russell Friedman.